we are trying very hard to take a middle ground approach, not to go into either extreme of staying put where we are, nor opening up too liberally and risking a surge of cases that can overwhelm our healthcare system.
Good afternoon, I'm Haryanto Diman. The public is disappointed and the ministers know it. In a press conference this afternoon, the multi-ministry task force giving an update on the COVID-19 situation and the extension of restrictions to November 21st. At the same time, explaining the rationale behind the move and giving reassurances that Singapore remains committed to living with the virus.
We are heading towards a stage where we strike a balance and an equilibrium with the virus and able to live normally with COVID-19. So you think about this as riding a bicycle down slope. If you do nothing, the bike goes faster and faster until you lose control and the bike will crash. But if we apply the brakes just right, the bike can go down the slope at a steady, controlled speed. So the equivalence of the downslope is the Delta variant and its transmissibility. Left on its own, it has a reproduction rate of 6 to 8. This means for every infected person, he or she can pass to another 6 to 8 persons. It also means that every week, cases do not just double. Cases can increase by 6 to 8 times if you do nothing. That's when it's uncontrollable and the system will crash. That is why we apply brakes on the transmission.
The Home Recovery Programme, or HRP, which is now the default care arrangement for most COVID-19 patients, will be extended to more groups. Here's Minister Gan Kim Yong with the details.
The HRP has made good progress. More of us are now familiar and comfortable with it. Our processes and support system for the HRP are also more established and stabilized. Therefore, we will now extend the HRP to pregnant COVID-19 cases who are fully vaccinated, below 35 years old and less than 26 weeks pregnant. This will allow more to recover at home.
Changes to workplace measures also announced today. From January 1st, all workers who return to the office must be fully vaccinated or have recovered from COVID-19 in the past 270 days. Unvaccinated staff members will need to first test negative on a pre-event test, which they have to pay for. These testing requirements will also apply to medically ineligible people and pregnant women. The SINOVAC vaccine will now be part of the National Vaccination Program to cover those unable or unwilling to be vaccinated with mRNA vaccines. Those who opt for SINOVAC should take 3 doses, excluding the booster shot. This means adjustments will be made for the vaccination status of those already jabbed with 2 SINOVAC doses, especially considering there's an interval of 90 days between the second and third doses. Anyone who's taken 2 doses of the vaccine will be regarded as fully vaccinated for 4 months after the second dose or December 31st this year, whichever is later. However, SINOVAC's vaccine will not be offered as a booster for those who have completed both doses of an mRNA vaccine with no allergies or severe adverse reactions. For those who started the regime with mRNA vaccines but with adverse reactions after the first dose, they should complete the 3-dose regime with 2 more SINOVAC doses. If the adverse reaction happens after the second dose of an mRNA vaccine, then they should take 1 more dose of the SINOVAC vaccine as their booster shot when eligible. The SINOVAC vaccine has not been approved for those 12 to 17 years old, but anyone in this age group who's medically ineligible to complete a full regime of the Pfizer vaccine will be offered a 3-dose regime with SINOVAC. COVID-19 testing protocols will be streamlined for travellers arriving in or transiting through Singapore with effect from 11:59 p.m. on October 26th. All travellers in Category 1 countries or regions and those on the vaccinated travel lanes will only need to take 1 PCR test when they arrive. Travellers from Category 2 countries not on the VTLs who still need to serve SHN, as well as those arriving from Cat 3 and 4 areas, they'll only need to undergo a PCR test at the end of their SHN. They will no longer take an on-arrival test. Also, from the night of October 26th, Malaysia will be considered a Category 3 country together with Cambodia, Egypt, Hungary, Indonesia, Israel, Mongolia, Qatar, Rwanda, Samoa, Seychelles, South Africa, Tonga, United Arab Emirates and Vietnam. Travellers from these places will be subject to the updated Cat 3 testing protocols I just mentioned, as well as an SHN at their declared accommodation. Meanwhile, travellers with a 14-day travel history to these 6 countries will be allowed to enter Singapore under Category 4 border measures, which include a 10-day SHN at a dedicated facility.
There are many benefits to Singaporeans when we open up our borders. One, Singaporeans can travel for study, for work, or leisure with their family. Second, we can start to bring in much needed workers to complete our BTO projects, to complete various public infrastructure and other projects that we need. Third, MOM can start allowing in more domestic workers to relieve the stress on many families in Singapore. Hence, we are making a few changes. We are lifting the not to land rule for Bangladesh, India, Pakistan, Sri Lanka, Myanmar, and Nepal. The situation in these countries have stabilized for some time, and there is no longer a need for a strict not to land rule. Further, MOM will also be increasing the entry of foreign domestic helpers. Today is 200 a week. It will be increased to 1,000 a week. And this will help them to start to clear the backlog of applications from families for domestic helpers. And MOM will review the entry number regularly together with the MTF with a view to try to fulfill the needs of families as quickly and as promptly as possible. And I think these 2 steps will make life easier for many businesses, for contractors, as well as for families.
So, what's next in Singapore's COVID-19 journey? Well, Minister Lawrence Wong says a key indicator the task force is closely watching is a weekly infection rate, also known as the reproduction rate. It used to be 1.5, but it's now come down to just above 1, meaning that cases are still increasing, but at a slower rate.
We monitor this ratio closely, and if the ratio comes below 1, and our hospital and ICU situation remains stable, we will make some calibrated easing in 3 areas. One, we are looking at allowing team sports to resume. For example, a group of 5 people can play football with another group of 5 people or any other contact sports. Second, we will look at resuming more activities in our schools and institutions of higher learning. And thirdly, we will allow family members from the same household to dine together in F&B establishments up to a group of 5 persons. These are calibrated moves where we assess the risk to be acceptable.
Visit straitstimes.com for more on today's announcements. You can also watch the press conference on the Straits Times' YouTube channel. Remember to subscribe by hitting the button below. I'm Haryanto Diman. Take care and I'll see you soon.